Hi, my name is Kendra Bowe, and I'm going to be talking about health literacy in regards to healthcare management. So, to start off, what is health literacy? Health literacy can be defined as many things, but we're specifically going to look at two definitions provided by the World Health Organization and the American Medical Association. So, the World Health Organization defines health literacy as the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand, and use information in ways that promote and maintain good health. The organization defines health literacy as a constellation of skills, including the ability to perform basic reading and numerical tasks required to function in the healthcare environment. So, why is health literacy significant and why is it important? Well, approximately 80 million Americans have limited health literacy, puts them at a greater risk for poorer access to care and poorer health outcomes. Health literacy is central to multiple health system priorities, including quality, cost containment, safety, and patients' involvement in healthcare decisions. Those without adequate understanding cannot function in a market designed for active and informed consumers. They are the ones that are most likely to be left behind. Reading fluency allows an individual to expand one's vocabulary and gain conceptual knowledge. Vocabulary and background knowledge of the general topics covered in written material improve an individual's comprehension of the material. It is easier to read and comprehend material that contain familiar vocabulary and concepts. For example, two individuals with similar general reading fluencies may have different abilities to read and understand health-related material as a result of difference in their baseline knowledge of health vocabulary and concepts. It's also important because low health literacy increases the risks of many things, which some of these include needing medical emergency care, poor health in elderly patients, not getting the flu vaccine, being hospitalized, not understanding diseases and conditions, serious illness, and mismanaging medications. So in regards to cost, a study done by Wise and Palmer found that a person with low literacy skills generate higher charges for healthcare than do persons with better reading skills. The difference was large, statistically significant, and had clinical meaningfulness. It supports results of other research which has found that persons with limited literacy skills have poor health status, are more apt to be hospitalized, and make more visits to emergency rooms than their literate counterparts. So, in theory, an individual with low literacy levels comes in to the physician's office and gets diagnosed and has a treatment plan set up. Well, if this individual does not understand the diagnosis or how to go about treating their illness or a disability, they most likely will return again and again for the same issue, which will lead them to have unnecessary tests ran or rack up a bill due to insurance issues, and it ends up costing not only them but the organization more money because they are constantly battling the same problem. In regards to quality of care, the Institute of Medicine listed health literacy as one of 20 priority areas in which quality improvement could transform healthcare in America. The literature documents that problems associated with poor outcomes. Those with inadequate health literacy have less knowledge about their medical conditions and treatment, worse health status, and a higher rate of hospitalization than the rest of the population. So, as we previously stated, the individuals are not getting the care they need because they are not understanding their diagnosis, therefore that they are not fixing their situation. In lines with these assumptions, patients living with limited health literacy skills have been variously found to exhibit faulty knowledge of medication, deficient self-management of care, unwillingness to be engaged in the provision of health services, and overall poor health outcomes. So, in terms of access, patients with inadequate functional health literacy had an increased risk of risk of hospital admission. In a study done by Levy and Jink, the most common reason for delay of healthcare was that they could not afford it. These understand the insurance forms or how to get insurance. Therefore, they waited to seek help because they knew it would be very expensive without the insurance. Health literacy matters for access to care because individuals with low health literacy are more likely to delay getting care and have more difficulty finding providers than their counterparts with adequate health literacy. Even after insurance status and other characteristics were controlled in this study, the barrier compound any subsequent difficulties that patients with low literacy may face in terms of understanding and acting on information from clinical encounters. So not only are these patients not able to get care or they have a delay in care, they're having a hard time finding physicians that will see them. So what can we do to improve as an organization? One thing we can do is make the patient our key focus. Focus on patient-centered care and health literacy to help set up a framework for our organization. Instead of presenting the information as we can tell stories that might be more relatable or these patients might understand better in a format of a story. We want to make sure we are using clear communication to these patients and that our providers or healthcare workers are aware of this issue and can make necessary adjustments for anybody who does not understand or has a lower. In terms of the organization, we could provide proper education and training to our staff, strategies of information and in training sessions for the workforce. We can develop processes and implement whole of organization policies which embed health literacy considerations into existing processes. We can use language that is easily understood and symbols on information and signage, pamphlets we have available, or the signs as to where a patient may need to go. We provide support for consumers, such as an interpreter would be helpful. And we want to make sure the consumer is taken into consideration so that we can not only help them but help others that may not understand what anything health related or have a low health literacy score. So when we go about designing our new policies or training sessions, we want to have the consumer in mind and work with the consumers to develop, design, and evaluate information materials such as like brochures, pamphlets, forms, and referrals. And we want to work with the consumer to plan, design, and evaluate services and facilities. So, like I said, as an organization, we want to be successful. We want to provide the top-notch care and quality care to our patients. With those individuals of low health literacy, we need to take into account the cost factor for them and for our organization. We want to obviously provide the highest quality of care to these individuals and ensure that they are receiving the proper material that they would be able to understand and take home and use to follow their treatment plan or just know what their diagnosis is so that they aren't left confused and afraid. And in regards to access, these individuals, if health literacy policies or systems are put in place, should allow individuals to gain access, whether it be insurance wise or ways to contact facilities. These individuals will hopefully be able to access care more easily once health literacy policies or health literacy considerations are taken. So thank you for listening, and hopefully health literacy can be taken into consideration to provide the highest quality of care to all patients, and that patient-centered care is our number one priority. And here are my resources that I used for this presentation. So thank you for listening.